Good day to everybody. My name is Iva Žegura. I am specialist of clinical psychology. I work in University Psychiatric Hospital Vrapče and also collaborate with several departments of psychology in Croatia. Sexual orientation, gender identity, gender expression, and our biological self, among other aspects of our self, represent the core concept of self and therefore are not to be pathologized or in either way stigmatized. It is important that as therapists as well as clients accept their sexual orientation and gender identity. For the therapists and other professions in the medical field and mental health field, it is important not to presume somebody's sexual orientation or gender identity, but to keep in mind the whole spectrum of representations that are each valid, each specific, and should be recognized as unique as we see each of our clients and respect them as unique human beings. Intersectionality is a framework for conceptualizing a person, group of people, or social problem as affected by a number of discriminations and disadvantages. It takes into account people's overlapping identities and experiences in order to understand the complexity of prejudice they face. When LGBT people apply negative attitudes toward themselves, especially the feelings associated with internalized homophobia, transphobia, biphobia, the psychologically injurious effects of social level homophobia often take effect. Such attitudes and risk behaviors increase exponentially when a member of the gay or bisexual community is also a member of a minority, racial or ethnic group, having multiple minority statuses. Increases the likelihood of experience of homophobia, transphobia, biphobia, stigma, isolation, and rejection, along with the heightened risk of sexual risk behavior, different experiences of violation of LGBT human rights, or substance abuse. Please mind that healthy development of sexual orientation and gender identity and their integration are obvious prerequisites for healthy psychosexual and psychological development. Cisgender heterosexual people often take this for granted, while the task of developing integrated and positive sexual orientation and gender identity is a challenge for many LGBT people, given the current cultural and social climate. Be aware of scientific and psychotherapy modalities paradigms that are based on the majority cultural background that represents heteronormativity, gender binary concepts, patriarchal models, and Western culture. Learn about LGBT culture, learn about cultural resources for LGBT people. Get knowledgeable about issues specific to LGBT people. Learn about important health and legislative issues. Identify barriers and use scientific and professional knowledge to be ally of LGBT people and advocate for their rights. Help them within the system during the process of gender transition or during the process of coming out. Educate professionals, educate public and legislators as well. Speak out and be aware of your own privilege as being a part of majority, or if you are LGBT psychotherapist, be aware of your minority status as well. It is good to find support and supervision from LGBT-informed colleagues. Do not assume. Always ask your clients, check with your clients. Ask how person self-identifies in relation to gender identity and/or sexual orientation. Be open to different ways in which persons can be expressing themselves, can be identifying themselves in the spectrum of gender identities and sexual orientations. Every person, either transgender or cisgender, involved in counseling or psychotherapy process is an expert in their own gender identity and sexual orientation. The client's self-determination is priority over the mental health professional's frustration, his/her confusion, or personal opinion. It is not up to the clients to deal with the expert's feelings about gender, non-binary identities, or different sexual orientations. Respect pronouns of your clients. Non-binary identities are challenged to fundamental social assumptions about gender, and mental health professionals should actively research and increase awareness of their own attitudes toward their gender identity and gender identity of their clients. Do not assume the outcome of the transition process. Some gender non-binary persons may question their own gender identity and/or its expression. Others are satisfied with their gender non-binariness. Do not assume that passing as a man or a woman in the society is the ultimate goal, and do not encourage it if it does not match and does not respect person's self-determination. Recognize the countertransference or desire to save the client in the way that protects him or her from the risk of being between or outside the gender categories or sexual orientation categories as well. Realize that social presentation or transition is layered and complex. A person's gender role can vary in the different aspects of their life. For example, it does not have to be the same in the sexual relationship or within the family circle or at work. Coming out is a lifetime process. Do not push them to come out. It is not a goal to be achieved. Be aware of specific needs of LGBTIQ people through lifespan and minding intersectionality issues. Mind the different aspects of intersectionality when working with LGBT clients, together with awareness of own intersectionality and minority status as therapists. What are sexual orientation change interventions? They represent so-called conversive therapy, reparative therapy, that are a range of dangerous and discredited pseudoscientific practices that falsely claim to change person's sexual orientation or gender identity or expression of gender identity. Such practices have been rejected by every mainstream medical and mental health professionals and organizations for decades. But due to continuing discrimination of societal bias against LGBT people, some practitioners unfortunately still continue to conduct conversive therapies. Minorities, and especially minors, are vulnerable and by the effects of conversive therapy that can lead to depression, self-medicalization, anxiety, drug use, homelessness, and even suicide. Some right-wing religious groups promote the concept that an individual can change his or her sexual orientation or gender identity either through prayer or other religious efforts or through so-called reparative or conversion therapy. The research on such efforts has disproven the efficiency and also has indicated that they are harmful. Beyond studies focus solely on reparative therapy, broader research clearly demonstrates the significant harm that societal prejudice and family rejection have on lesbian, gay, bisexual, transgender, and queer people, particularly youth. Furthermore, there is significant evidence on harm to LGBT people resulting from attempts to change their sexual orientation and gender identity. In 2007, American Psychological Association undertook a thorough review of existing research on the efficiency of conversion therapy. Their report noted that there was very little methodologically sound research on sexual orientation change efforts, and that the results of scientifically valid research indicate that it is unlikely that individuals will be able to change and reduce same-sex attractions and increase other sexual attractions through sexual orientation change interventions. Based on the body of evidence, every major medical and mental health organization in the United States and European Union, as well on other continents and in other countries, have issued the professional and ethics guidelines and statements condemning the use of conversion therapy. For example, you may find on the website of the European Association of Psychotherapists their statements on conversion and reparative therapy for normal variants of sexual orientation. The most important notice to take home is that sexual orientation change interventions and interventions that aims to change gender identity are unethical processes and should not be practiced because they rely on pseudoscience. I will leave you today with one more statement of Paul Goodman, Gestalt therapist, writer, philosopher. The philosophic aim of education must be to get each one out of his isolated class and into the one of humanity.